Hello, everyone. Welcome to today's webinar hosted by NGA's Center for Best Practices and the Water Policy Learning Network, which is under the Energy, Infrastructure, and Environment Division in the Center for Best Practices. So the the network serves governors, water policy advisors, so that is our main audience for today. And today we're going to focus on the impact of COVID-19 on water sector revenues. We'll be discussing projections for drinking water and wastewater, stormwater revenues, and the assumptions behind the projections, and also, more importantly, short and long-term strategies to address these revenue losses. So this is Bevan Bucheister, and I'll be the moderator today. And I am joined by my colleague, Timothy Schoenhoven, who's a policy analyst with NGA, and also Alex Whitaker, who leads our natural resource. So let's see, I need to advance these slides. Timothy, can you help me advance the slide? So I just wanted to do a little bit of housekeeping first and invite you all to ask questions, and just wanted to let you know how to ask questions on a Zoom webinar. So on the control panel, it's either at the bottom of your screen, mine's at the top, there's an icon labeled Q&A. And so you click on that icon and a screen will pop up and you can type out and submit your questions, and Timothy will be monitoring them and helping out and asking them later. Or you can navigate to the control panel and click on the chat icon, and a new screen will pop up where you can type and submit comments for all participants. And so we'll be posing those comments after each speaker, and after all speakers have gone, we can pose them to all speakers. So let's see. So, as we have seen, and we are all experiencing over the last 6 weeks or more, COVID has interrupted the economy. And last week, AWWA came out with projections on revenue losses for the drinking water sector, and that was coming in at 13.9 billion in the, from now to the next year, in the coming year. And then NACWA came in with some estimations on revenue losses for the wastewater and stormwater section, and that was estimated to be 12.5 billion over the coming year. So it goes without saying that interruptions or denials of service will also have a big impact on public health, economic vitality. Water services are critical for other services, you know, not just homeowner use, but for firefighting, healthcare, energy, food, agriculture, and transportation systems as well. So these revenue loss projections are coming from moratoriums on disconnections. So I just wanted to show you some information that NGA has gathered. We found that 28 states and DC issued moratoriums for water utility disconnections. And then 12 more states have voluntary commitments from their utilities to halt disconnections during this COVID crisis. So wanted to also let you all know that NGA's letter requesting stimulus funds for this next supplemental 4 included water and essential utilities in the ask, and the overall ask was for 500 billion in unrestricted funds to states. So we didn't put any numbers in there for different sectors because states have different needs, so we're just asking for 500 billion, but wanted to point out that essential utilities and water were cited in our letter. Also wanted to point out the Water Association's letter that asked, I think this was a few weeks ago, for maybe supplemental 3, for asked for the to cover the cost of moratoriums on disconnections, asked for grants or loans to fund operations of utilities, and for strong funding for the established water infrastructure programs. And you can see the sign-ons to that letter in the, you know, like down at the bottom of that. And there's also a link to this. Also wanted to mention that this webinar is going to be recorded, and we will be sending you a link to the webinar afterwards, to the recording afterwards. So I wanted to introduce today's panelists. So we have Tracy Meehan, who's the Executive Director of AWWA, Executive Director of Government Affairs, I'm sorry, of AWWA. And so they had issued a report last week with projections. So he's going to tell us about them and what the assumptions are behind them. We also have Adam Krantz, CEO of National Association of Clean Water Agencies, and he's going to tell us a little bit about their projections. And then I've invited Nathan Oley to speak, and he's the CEO of RCAP, the Rural Community Assistance Partnership. And so with these revenue losses, we are very worried about the small and rural water utilities that might not be able to weather this kind of impact. So we do have 53,000 drinking water utilities in the US and 16,000 wastewater utilities. So a lot of those drinking water utilities are small, and I'm sure a good number of those wastewater utilities are small too, but I'll let them talk about that. And then we also invited Deirdre Finn, who's the Executive Director of the Council of Infrastructure Financing, to tell us about, what states can do with their SRFs to address this situation. So let me hand it over to Tracy Meehan, who's going to talk about their report and the numbers behind that.
Thank you, Bevan. Again, this is Tracy Meehan with AWWA. We have about 50,000 individual members and 4,200 utility members, all focused on the drinking water, provision of drinking water, although about 60% of our utility members are combined systems and overlap with some of Adam's membership on the wastewater side. It has been estimated by some people that our top 400 members probably serve 80% of the American population. So it gives you, in light of the fact there are 51 to 53,000 community water systems regulated under the Safe Drinking Water Act, you kind of get a sense of where we are in that universe. A simple thing of looking at our report, and I believe, Bevan, you've got a slide with the breakdown of the figures from our report. Essentially, there's two things to keep in mind. 80%, roughly 80% or more, and again, it's an average of operation of a drinking water utility, 80% are fixed costs. Yet most utilities are, their pricing model, not completely, but is mostly a volumetric pricing model dependent upon the volume of water that is sold. During this, this virus crisis, clearly with businesses shutting down, people staying at home, this has had a big impact on the utilities, including the safety of the employees. And we were most happy that EPA had designated water and wastewater workers as essential employees, and we hope that your respective states are kind of viewing it the same way also. But as you look at this, these columns here of cost impacts on the utility sector, the big one is commercial revenues, which on an annualized basis comes to about $7.38 billion, on the negative side. And I guess to illustrate, I mean, the business shut down, they quit using water, therefore there's less revenue. I heard of one small utility in the Southeast that its biggest customer was the school district, and the school district shut down and it lost 40% of its revenues. So this obviously has dramatic impacts. The whole, commitment of most utilities, almost all the utilities, not to shut people off, that's going to have some impact, and maybe more over time. We'll just have to see. And then, of course, there's any number of these expenses here are pretty clear. All this adds up to a bottom line figure of about $13.9 billion. But then there is the question of the delay and the reduction of capital expenditures, again, on an annualized basis. And we think that that it doesn't show up on this this tally sheet, but would be another $5 billion. So the total hit, you could argue, and I admit these numbers were done quickly at the request of Senate staff, could be 15 billion. And then in addition, there's the macro impact on the overall economy using various multipliers that economists can use to sort of impact things, measure the impact of X amount of reduction of income and revenue and investment and construction. And the smart people at the Raftalist company came up with a figure of $32.7 billion hit to the economy of these communities, with as much as 75,000 to 90,000 jobs lost. So again, the root problem is the loss of revenue due to the shutdown. It's a pretty simple concept. And if you look at the executive summary of the report and then go to page 25, there's a little more of an elaboration of the main elements of the analysis. It's based on AWW had paid for this report. We relied on databases that Raftalist had with the many utility clients they have, and some survey work they've done for us in the past, as well as for AMWA. AMWA was good enough to contribute their databases, which are maintained by Raftalist, and they are a co-sponsor of this report. So that's really it in a nutshell. We try to do some analysis in the report by regions. You can look at those, that background information. But again, the estimate came in pretty close, just a little bit more than the numbers that NACWA and AMWA had come up on the wastewater side. So you add everything together, you're at about a $27 billion hit to the water sector, combined water and wastewater. So thank you, Bevan.
And so, Tracy, I was just going to ask you, how soon is this affecting the drinking water and wastewater systems? Is it this month that they are starting to feel these revenue losses? And also, have you heard how local governments or states are financially supporting them? Are they dipping into emergency revenue, or what's the picture out?
I haven't heard much aid coming from, I haven't heard much at all really about aid coming from, say, if they're embedded in municipal government, the overall city government, even states. That isn't to say it's not happening. It may be happening, but I just don't hear it. I mean, the impact is immediate. I mean, that's the bottom line. I mean, you shut off the spigot of dollars, all of a sudden you start, taking steps to preserve cash, postponing, canceling projects, reducing hours, furloughing employees. All this happens at once. In the meantime, they're doing split shifts to keep operations running and protect staff. A lot of efforts of great staff camping out on 24-hour shifts to maintain the facilities. Yeah, it's pretty drastic. And while there are construction projects that have been designed and contracted and are ready to go, a lot of things are just simply put on hold. You freeze, and that sets up this whole cascade effect described in our report.
Right. And Tracy, can you repeat again, what was the larger number of all the cascading impacts, the larger financial
sort of the macro effect, the
yeah.
economic effect is calculated by Raftalist at $32.7 billion, with a loss of jobs in the range of 75,000 to 90,000.
Mm-hmm. And that's just over starting now, projecting a year out. Is that correct?
Yeah, that's annualized.
Okay.
Mm-hmm. Yeah,
All right. And so I just did get some requests from people, and I will send a link to this report along with the recording of the webinar after we're done. So go ahead, Tracy. Did you want to mention something else?
No, I was just going to say, on the slides you have up, we calculate, the report calculates the impacts at 2 months, 4 months, 6 months, and then the annualized impact.
Yeah, okay. All right. Good work. Thanks a lot. And let's turn now to Adam Krantz, who's the CEO of National Association of Clean Water Agencies, to take a look at the revenue decline in revenue projections that their association came up with.
Yeah, thank you very much, Bevan. I hope folks can hear me
Timothy,
okay.
if you could help me advance the slide, I'm having a little internet connectivity issues. All right, Adam, go ahead.
All right, thank you, Bevan. The joys of Zoom video here. Just wanted to echo a lot of what Tracy said in terms of the revenue loss side of the ledger. We estimated about a $12.5 billion loss on the wastewater treatment side several weeks ago, based on surveys of our members. Similar experience with the previous Great Recession And that calculates to around a 20% or so revenue decline. Those revenue declines are coming from a number of areas, increasing delinquencies, especially on the low income side. And as you see, unemployment increasing dramatically. The reality is a number of folks simply just don't pay their water bills. So that's becoming another big issue, separate and apart from that 12.5 billion that they're going to be facing. So the issue of shutoffs and having to turn everyone's water on. One thing I want to mention relative to coronavirus, which is different from previous emergencies and crises, is that this is really a water-based crisis. We're all at home. Many of us we need to wash our hands. We need to wipe everything down. The supply of clean and safe water is critical. The need to ensure that we can flush our toilets safely and without blockages so that no one gets sick and is forced to potentially have to go to a hospital right now where they're facing their own crises, links this particular moment to water in a way that is incredibly, I think, important for us to take into consideration. And in line with that, for the first time in quite a long time, the federal government, from the Department of Labor, the Department of Homeland Security, EPA, they have all now defined water, wastewater service workers as essential workers and emergency workers. And one thing I do want to say is I hope that in line with EPA Administrator Wheeler's letter to all the state governors, that states do that as well. I think it is incredibly critical at this juncture. And the reality is, with that 12.5 billion loss that we're talking about, at the same time that that's taking place, and unemployment picture increases, which means less and less revenue coming into the utilities, they're also being asked and are willingly paying their workers more hazard pay to go out and do the essential work of operating water, wastewater systems, going out and doing routine maintenance, critical maintenance, if there are any main breaks, etc., sewer main breaks, all of that stuff. The water needs to be functioning in a seamless, uninterrupted way, 24/7 during this period. And so at the same time, the expense side of the ledger is going up as they have to pay key workers more pursuant to the hazards that they have to go out and face. So I wanted to make sure that was clear as well. As it relates to our efforts with Capitol Hill, NACWA, is an advocacy-based organization. We would very much like to have the governors with us in making our asks. The high 500 billion that you mentioned, Bevan, is certainly helpful, but we are looking for certain things that are specific to the water, wastewater sector. In addition to any funds that can be used to overcome that 12.5 billion loss, we are looking for specific funds to utilities so that they can continue to provide wastewater services to all of their customers, regardless of their ability to pay during this period. And that is a growing challenge for them as delinquent bills continue to mount at the local level. At the same time, on the clean water side, where the Clean Water Act is the governing piece of legislation, we are highly, highly regulated as a sector with very costly and high technology-based requirements that are placed on us, both in terms of monitoring and in terms of removal of pollutants that only continue to mount and add cost to our ledger, so that even before this crisis has hit our sector, we were looking at $1 trillion infrastructure funding gap and about a $300 billion EPA estimated gap in complying with all the regulations we already have to face at the state and local level. And the reality is that as the financial picture becomes a little darker for our water and wastewater utilities, if the federal government at this point does not step in, clearly our utilities are going to be looking to states increasingly to help out with that. So the revenue losses that we're facing, the difficulty in getting our our bills paid, the lack of connection fees as construction is halted on new developments, new malls, new office space. All of those things are hitting our members in a very, very direct way. And we hope that the federal government will take a partnership approach with us going forward, though they have not done so yet. I do think there are aspects of the CARES Act that could apply to water, wastewater utilities, but frankly, including $150 billion that would go to state and local governments, it just hasn't been really seen that way. And those funds are eligible only on the expense side of the ledger, not the lost revenue side of the ledger. I think that's a very important point here that we need to make. In addition to the revenue loss, one big issue for us is the fact that we do have enormous projects that are underway, and that the lack of revenue coming in now means that a lot of the expansion, the maintenance, the infrastructure work that employs many people, as Tracy mentioned, is going to have to be delayed. The delay in the water side on infrastructure, unlike other infrastructure areas, isn't an inconvenience. It becomes a public health and environmental issue. And the reality is the benefits similarly are also different, and they do add to the public health and to our environmental well-being in a unique way. And so on the one side of it, and I know Deirdre's going to go into this a lot more in terms of the $70 to $80 billion or so that states have in projects that have already been listed for municipal water wastewater projects. We are in a sort of sector, if you will, that can help the employment picture, create jobs pretty quickly. We have a good record of that with previous stimulus bills and through the state revolving loan fund efforts and federal and local partnership. And my hope is that in addition to providing some federal funding to brook that revenue loss, we're also going to be looked at as a go-to sector for stimulus package funding as the jobs picture. I think we're already at close to 20% unemployment. We need to be seen as a sector that can help resolve some of those problems. And if the feds don't come in, I think, in a big way on this, there's going to be an increasing pressure on states for that funding. So we are been hearing from other municipal groups looking at that $1 to $2 trillion in infrastructure funding. I would just say that in the stimulus bill, the ARRA, of the close to $1 trillion, only $75 billion went to infrastructure overall. Of that, water and wastewater was about 15% or $10 billion. If we are looking at a $1 to $2 trillion infrastructure package, we're hoping to see a much higher level of funding, and we believe that we're going to be in a position to be able to help bring jobs back to the economy and do it in a way that makes for a lot of environmental as well as economic and public health benefit. So I will leave it there and happy to answer any other questions. And lastly, the only thing I would say is in terms of these projects, if this revenue is not coming in, we all know about a lot of core areas, whether it's lead service replacement, PFAS related issues that we've heard a lot about, nutrient pollution. A lot of key public health issues also are linked to the work that we do and the ability for us to do that without any delay, without any sort of pushing off, core projects. And my concern here is relative to our sector. If that is the picture that's starting to emerge, we need the strongest possible local, state, federal government to ensure 24/7 water and wastewater services going forward. Thank you for the time and happy to answer any questions.
Yeah, thanks, Adam. So this is Evan, and I'm seeing we do have a question, and I'll pose this to Adam and Tracy. It has to do with the revenue projections, and it says, did you consider the reduction in other expenses that result from COVID-19 impacts, such as travel, entertainment? So I think that question is also the reduction in other I guess expenses I guess
Yeah, Bevan, I'll take
let you jump in.
Yeah, I'll take a first stab at that if I can, and the answer is yes. You know, a lot of them, you know, our members are the major metropolitan areas, et cetera. And what they're seeing is, you know, especially if you're on sort of a block rate system where larger users are paying more. If you have a, you know, major sports arena that's empty, a major mall that's empty, if you have your airports being empty, and those are your largest users, the hit to you as a municipal entity in terms of revenue is enormous. And so for a lot of our members, the problem is we're early on into this coronavirus problem. So you're looking at some who bill monthly, some who bill quarterly. And my point that I'm trying to make is that that picture will only darken the longer this lasts, and those larger sort of rate-paying entities that you mentioned, you know, continue to not be using water to the degree that we're already seeing. So it's a very scary picture that's being painted. Tracy?
Okay, and Tracy, you want to comment on that?
Yeah, I'm not sure about those entertainment expenses. We like our work, but I don't know how much of a good time you have a treatment plant. But on the other expenses, if you note in the executive summary of the Raftless report, we have an item there called increased personnel expenses, and annualized that comes to about $0.63 billion. And that could include everything from hazard pay to overtime pay to protective PPE, protective gear, all sorts of things like that. And that was accounted for in the Raftless report. Now, we did see an increase in residential water revenues because there's more people at home longer. I guess people are taking longer showers or using more water. You got the whole family in the house. So, you know, that was factored in, and we include that in the calculation. But, you know, in the main, this is, you know, there's not a big upside that we can see to the loss of this much revenue so quickly.
All right, thanks. And now I wanted to invite Nathan Oley, Chief Executive Officer, Director of the Rural Community Assistance Partnership, to comment on the impact that they are seeing or they are hearing about on small and rural drinking water and wastewater systems. Trying to advance this slide. Got some, Timothy, if you could help out and advance the slide, appreciate that. Okay, got delayed response here. All right, so Nathan, so I just wanted to invite you to talk about the particular challenges that small and rural utilities already have, and then what you're seeing with the impacts of COVID.
Absolutely. Thank you very much, Bevan, for the opportunity to be here and be a part of this great panel. I'm Nathan Oley. I'm the CEO of RCAP, the Rural Community Assistance Partnership. We are actually a national network of nonprofit partners that are providing technical assistance and training to rural and tribal communities across the country. We have a little over 200 folks across our network, someone in every state, including Puerto Rico. And so certainly for those of you from governor's offices, happy to make sure your teams are connected in with the folks that we have on the ground as you're looking for more information or specifics on small, rural, and tribal communities. From a big picture perspective, just want to set the table a little bit. When you look at public water systems, there's almost 150,000 of them across the country. 97% of those systems cover communities of 10,000 or less. And on the wastewater side, there's about 15,000 public wastewater systems. 72% of those cover communities of 10,000 or less. And so when we start talking about overall impacts in the water sector, it's really important to have that context that a majority, a super majority in many cases of these systems are in really small and sometimes distressed communities across the country. And so the impacts that we're seeing across the water sector are hitting rural and small communities at a rate that we haven't seen in the past. And so it's a really critical time for the water industry in general, but specifically for small community systems, both on the water and wastewater side. And I also want to set the table that, you know, before the pandemic happened, there were a lot of issues that were already impacting the water sector. There are more than 2 million people across the country that don't have access to safe drinking water, and an estimated 1.6 million Americans that lack access to complete plumbing. And in tribal communities in particular, they're 19 times more likely than white households to have indoor plumbing. And so these issues are all impacting small communities in really unique ways, but also ways that we're seeing all the way across the water sector. In relation to the COVID-19 pandemic, there's a few issues that we're really particularly focused on, and getting more information from the communities that we serve, but also more broadly across rural and tribal systems across the country. The first and foremost is one on workforce. Many of these communities, especially the smallest of the small, may only have a single operator that are working for those systems. And so it's about ensuring, number one, the health and safety of those operators. And you heard Adam and Tracy both talk about the need for PPE and the need for governors to make sure that water and wastewater operators are part of that issuance of primary personnel and have access to PPE, and ensuring their health and safety and quite frankly, the health and safety of their families are at the forefront of our considerations, because without those single operators, oftentimes those systems are going to be in real jeopardy of ensuring that the systems continue to operate and continue to provide the safe and clean water that we need in each of these communities. And so workforce is certainly an issue that we're focused on, and trying to ensure that there are backstops for those communities that have only a single operator, or maybe a contract operator that's operating several systems. And one of the ways that we do that is through partnerships and regional collaboration. We, over the years, have been a big proponent of regional collaboration, and in today's day and age, it's never been more important. There are mutual aid agreements, there are other emergency response plans that can be developed between and among communities that are really important to make sure that we've got the backstops in place, that we have the policies and procedures in place, so that when a pandemic like COVID-19 comes along, that those systems both are ensured to stay online and stay operating, but also that in the case of an operator getting sick, that we've got a backstop and someone that can come in and operate that system and ensure it continues to run and operate for the community. You also heard reference earlier from both Adam and Tracy about the water shutoffs and systems going through and putting people back online in water shutoffs, and it's incredibly important. It also has an impact both on the families that are getting that access, but also on the systems. And the family side, obviously having access to this, to safe and clean water is really important, but you also have to remember that oftentimes, just because that has been back on doesn't mean the billing for that family stops. And so that family may encourage or incur a large bill that needs to become paid due. And the issue for the system, obviously, is they're providing that water or wastewater to that family, to the residences, and even to the commercial entities. And they need to be backstopped for the water that they're providing. And so as we think about funding that needs to come back in to help these systems stay operational, but also to backstop the revenue losses that they're seeing, it's really important to make sure that's a component as well, that we're ensuring that while we're providing access to all families in these communities, that we're also not leaving an undue burden on those families on the back end. And so ensuring that whatever funding we're able to access through federal resources and certainly from state resources, that the back end costs to ensure these systems can continue to operate, continue to utilize the debt obligations they already have, and certainly the ones that they're going to need in the future, but ensure that we don't leave systems behind in that conversation, and obviously that we don't leave families behind in that conversation as well. The other thing I wanted to make sure to focus on today is a real need for states to think about how they incentivize partnerships and regional collaboration. Certainly for those communities that are already built this into their plans, it's a really well-used resource in the current environment. But I think as we start to come out of the pandemic, it's going to be really crucial for states to take a real holistic approach to how they incentivize and build opportunities for regional collaboration. Whether it's something as simple as the sharing of the cost of a water operator, or the back-end accounting system, or putting a mutual aid agreement together between communities, or more complex conversations down the road. It's really important that we're open and honest about these conversations and talk about the need for communities to work collaboratively as opposed to competitively, and to ensure that those communities are working with one another, both large and small, quite frankly, to ensure that they've got the safety and the priorities for their systems put in place in the right way, so that if a flood happens, a hurricane, or another pandemic comes down the road, that we've got some resilience built into our strategy about how we both respond and recover in the long term for these communities and for these systems. So thank you very much, Bevan. Really appreciate the opportunity to be here. Certainly happy to answer any questions that anyone might have.
Yeah, thanks, Nathan. So really, so you're looking at long-term strategies for resiliency, financial resiliency, and things like that, and that plays into what you all have been working on in the field with your technicians and all the a lot of small rural systems, the regional collaboration. So that looks like it's becoming even more important in these days of, restricted finances.
Absolutely.
So I wanted to ask you, so what other funding sources are you hearing about that are being used to fill the gap in the short term in these rural areas? What are they doing to, keep the lights on and keep the operators paid and keep the water flowing?
It's a really important question, and actually one that hits really deeply in rural and tribal communities. And that's because in these communities, often they're not big enough to be doing a bonding project that's going to, support the back end financing of this. Oftentimes they're looking for both grants and loans, either through state SRFs, through USDA or other resources. And the ability for those systems to continue to pay on those debt obligations and the ability of the systems to continue to operate from a revenue standpoint are really hindered in a time like this, because many of these communities are basing their lost reserves on the rates that they're paying to their communities. And so when you're in a community of 500 or 1,500 or even a 10,000, your ability to pull on those rates and have reserves in place is sometimes much smaller than big communities. And so we're actually going to be putting a survey out ourselves starting the first week in May to get a good understanding of both what are the revenue losses from small systems and to be able to build upon what AWWA and NACWA have already put together, but also to talk about what are those reserves that systems have in place. And so we can have an understanding of how long can they actually sustain these revenue losses without some additional investment from state or federal resources. Certainly we're talking to folks on the Hill and advocating very strongly that there needs to be some pretty big time investment happening, both to help offset the current losses on the revenue side, but also to ensure that we don't lose the pipeline of opportunities that really need to be happening over the course of the next 6 to 12 months and even 6 to 12 years. There's a huge backstop of infrastructure projects that need to be happening across the country even before the pandemic happened. And so we need to make sure that those systems have the capacity built in to ensure that they can continue those projects, continue serving these communities. And a big piece of that funding is not just straight funding to systems, but also technical assistance so that those systems can actually access the funding. One of the biggest issues that small and rural and tribal communities have is actually understanding, number one, what are the funding options that are available, and number two, actually being successful in securing those. And so technical assistance is really crucial to those small systems, both understanding and being able to actually execute and receive those funds.
And so Nathan, where are those technical assistance dollars coming from? And did you have enough before COVID? And what's it looking like, right now?
Well, I would certainly say that there's never enough, right? There are, tons and tons of systems that need some additional capacity. And certainly now during the pandemic, there's even more. There are resources through USDA, U.S. Department of Agriculture, as well as through the U.S. EPA that allow for technical assistance providers like us at RCAP and others across the country to be doing on-site technical assistance and training. In this environment, obviously, all that is moved to virtual. But so there are resources existing that help. But as we look at this pandemic and the crucial need that's going to have happen here in communities of all sizes, there's going to be a real need to make sure that the funding piece is there, but there's also additional funding for technical assistance providers so that those systems actually access the funding and ensure that they can continue their operations.
All right, thanks. And I'm pulling a question from the chat screen for you, Nathan. What do you think will be the most effective assistance programs that can be provided for small water and wastewater utilities?
I think it truly is those technical assistance, right? Ensuring that you've got competent providers in your state that have relationships with these communities. I think that's maybe the most crucial piece. In small, and especially in tribal communities, trust is really crucial to ensuring that you can be successful in any of these programs. And so having technical assistance providers that not just are competent, but also have those relationships and understand both the inequities and the issues that face these communities and can help them build capacity the hope through technical assistance is always that you're actually working yourself out of job, that there's no more need to build capacity. We know there's thousands, if not hundreds of thousands of systems across the country that need some help, and especially now with this pandemic. So building out technical assistance programs with competent providers and providers that have really explicit relationships in your state is going to be crucial to ensuring that those small rural and tribal systems continue to access these funding programs.
Thanks, Nathan. So I also wanted to throw a question out to all of you that have spoken so far. I've got a question online that says, which states are proactively tracking actual revenue losses across the water and wastewater sectors? So are the state, I know you all have done your surveys, but do you know if states are actively tracking them, the revenue losses? So Tracy or Adam can jump in on this one too.
I would probably talk to ASDWA about that. I have no information on that.
Okay. All right. Yeah. And I don't have the information on that yet either, but that's something we could, send out to our water policy advisors. But I think they're getting their information really from AWWA and the, associations, the NACWA.
And Bevan, we'll be happy once we get our survey back and complete. We'll be happy to share that with you, and you can share that across all the policy advisors as well.
Oh yes, very happy to. Thank you, Nathan. Definitely will do that. So now I want to turn it over to Deirdre Finn, Executive Director of the Council of Infrastructure Financing, and ask her about what states can do with their SRFs to address this issue, and short term, what can they do now? What can they do with maybe some other flexibility with the SRFs? And go ahead, Deirdre.
Thank you so much, Bevan. Can you hear me? Bevan?
Yes, we can hear you.
Okay, great. Could you advance to the next slide? So what I'm going to talk about, so the Council of Infrastructure Financing Authorities represents those state agencies that manage the Clean Water and Drinking Water State Revolving Fund. So my members actually work for the governors, either directly or indirectly. If you could go back to the slide before. So what I'll talk about, first I want to thank all of the governors and all of the governors' staff for their service during this terrible pandemic. You've done an awesome job, and it's really impressive, and proud to be an American, and really thankful for your service. I know it's long hours, but it's been really rewarding to see how spectacular you all have responded to this very new and a very unexpected crisis. So first, I'm going to talk about what the SRFs can do and what you might not be able to do. And I want you to reference down at the bottom our website, which is www.cfanet.org/InfoHub. So on that, there are profiles for each of your state SRF programs, which might be helpful as I reference some of the technical terms that we're talking about. There are also on the facts and stats sheet page, there are a couple of one-pagers, a primer on the SRF program, which might be helpful in helping you brief your principals on some of these issues. So just wanted to make sure that you are aware of those. And if you have any questions about the SRS, please feel free to reach out to me, and my email address is there, and my cell phone number is there. So what are the things that you can do now? So once a loan is closed and it goes into repayment, there is still the ability to do restructuring. And restructuring is sometimes used in sometimes it's called restructuring, sometimes it's called refinancing. I would recommend that you distinguish between the two. Restructuring is being able to delay loan payments or may even extend the term of the loan. Most SRF loans are 20 years, so you can extend them longer. Now that does increase the total cost of the loan, but it reduces the amount of debt service payments that have to be made, in the more immediate future. Refinancing is changing the interest rates, and as you'll see when you look at your state profiles or when you look at a comparison across all of the states, that the interest rates that are offered by the SRF programs are already so very, very low that it might not be worthwhile to actually do any refinancing. You can reduce or delay fees. Not all programs have administrative fees, but some programs do, and that might be an opportunity to reduce the costs on the SRFs. going back to restructuring is typically done on a case-by-case basis. So an SRF will look at, as Nathan was saying, reserves or their ability to pay or reductions in revenue and make a plan that's customized to the borrower. There was one state that did across-the-board postponement of repayments, and that was Vermont. That I just want to caution you that may not be possible in every single state. If you are a state that has a leveraged SRF program, which means that you've gone into the bond market in order to increase the availability of funding for your annual program, that you are almost 100% prohibited from waiving those repayments, because the repayments are pledged to the repayment of the bond. So if you want to know if your state is leveraged, you can look on our website under your state profile. And if you want to look across all the states, there is a one-pager that has information about, which states leverage and when they leverage. But that's something to be really careful about, because if you can't repay the bond, you're risk of default, and that could really impact almost all the SRFs have AAA bond ratings, that one of the best investment vehicles in the market. So it's just something to be really cautious about. But again, there's the opportunity on the case-by-case basis. On additional subsidization, again, if you have a leverage program, it's very unlikely that you would be able to do additional subsidization after the loan is closed and is in repayment. And part of the reason is because the vast majority of additional subsidization, which, just to explain what that is, it's basically free money. It's a grant or principal forgiveness or negative interest loans, but nobody currently uses negative interest loans. So it's really grants or principal forgiveness, that it's money that is provided to the community for the project that does not have to be repaid. And the difference between grants and principal forgiveness, grants come with a whole bunch of federal requirements, so it increases the cost of compliance and the burden of paperwork and process. Principal forgiveness is a grant without the paperwork. That's all you have to think of it. But it happens at the beginning of when you enter into the loan agreement. So it's not included if you're in a leverage program in that bond issue. And so therefore it's not possible to go back in and kind of rework how the bond issue would work. So it has been used by some states. I will say adding additional subsidization after the loan has closed is very, very rare. I've only found one state that's done it, and they even said that they only do it very, very rarely in very extreme cases. Loans that are in the current SRF pipeline, you can take a look at your subsidized interest rate. You may want to consider, reducing that even further, although when you see how low some of them are, and in some cases they're doing 0% loans already. I think the lowest in the country is 0.45%. I think the highest might be 2.6%, but again, it's required to be at or below the market rate. And so that is an option, just to keep those projects moving through the process. You can also look at how much you're providing in additional subsidization. So under the 2020 appropriations and current law, the state, the drinking water SRF is required to provide 20% in additional subsidization, 6% of that. If you can go back to the slide before, not ready to move forward, sorry.
Sorry, let's just keep it on this slide.
Yeah.
Sorry, I think we're two of us are confused.
Okay. So
I just want to ask you also while I'm breaking in, so
yeah.
how many, roughly how many of the state programs are not leveraged so they could do this postponement of payments?
Well, they may be prohibited from for other reasons. So and there are 16 that leverage frequently. There are 8 that leverage occasionally, but even if you leverage occasionally, you still have a bond issue. So it's about half the country. There's
Okay.
about, and then there are some that leverage kind of rarely whenever it's necessary. And so they're all different. But even the ones that could do a blanket postponement, it may not be something you want to consider, simply because it does disrupt your whole pipeline of projects, because there are issues with the revenue has to come in. If these are very sophisticated programs. I know people don't think maybe that they are as sophisticated as they are, but they do very sophisticated cash flow modeling. So if you stop all your repayments, you're essentially stopping all your project investments. So you really have to think through and talk with your SRF managers about the options to be able to, you know, what's feasible, what makes sense. I do think waiting maybe another 30 to 60 days before making any changes might be good until you get more data. I do think that we've already heard and from our SRFs that utilities have reached out to them about restructuring, and I know individual SRFs are helping individual utilities address those issues. So I think these are things that we're all aware of. Yeah.
All right. Oh, okay. So back to loans in the SRF pipeline. Sorry for the interruption.
So that's okay. So on the additional subsidization, so on the drinking water side, there's 20% of the capitalization grant, and on the clean water side, there's 10% of the capitalization grant that can be used for, well, I'm sorry, go back. So on drinking water, it's 14% of the capitalization grant can be used for principal forgiveness or grants for any applicant. 6% has to be used for disadvantaged communities. On the clean water side, 10% can be used for any applicant. Now, in addition to that, in the underlying Safe Drinking Water Act and Clean Water Act, the programs can use an additional 30% of the capitalization grant for principal forgiveness or grants if the community meets specific criteria. And this is where you kind of come into a challenge with the retroactive additional subsidization. You know, they have to meet the grant requirements, they have to meet the criteria in the law, they have to be a specific type of project in order to get that additional subsidization on top of what's mandated by the appropriations bill. So again, something to think about. Check with your SRF manager and take a look at your profiles, because you'll know right away what you've got. Set aside. So on the drinking water side, you can set aside up to 27% of the capitalization grant for technical assistance, and it comes in 3 basic pots: 2%, 15%, and 10%. The 2% is let me see, it's a small system technical assistance. That's the RCAP support that Nathan was just talking about. Then you've got 10% for state program management. Those are for statewide programs. And then you've got 15% for local assistance and other state programs, which are basically local programs. So again, your profiles will have how much you're currently spending. You're capped at 27%, but if you want to increase it, that might be a pool of money where you could help, particularly with capacity building for those smaller systems. Okay, now we can move to the next. Are there any questions that I should answer before I move on? No.
This is Timothy. We have a question.
Yeah, go ahead.
We have a question from the chat. Are IOU wastewater utilities eligible for clean water SRF funds?
I'm not sure I know what an IOU wastewater utility.
Investor.
Oh, investor-owned utilities. I'm sorry. On the private SRF, I'm sorry, on the drinking water SRF, it's private, privately owned utilities are eligible. On the clean water SRF, they are not, but there is an effort by the National Association of Water Companies, which represents the private companies, to make that expansion in this year's Water Resource Development Act. So that would be an association that you might want to reach out to about their effort. Okay, we can go on to the next slide. So SEFA has just recently on Wednesday launched the Safe Water. I'm sorry, go back one. The Safe. There we go. The Safe Water Infrastructure Action Plan, and basically our this is what our advocacy initiative is for any type of stimulus funding, and it is designed to save, accelerate, fill, and expedite projects in the project pipeline. And so I guess if there was one of our top priorities for the state is waiving state match. So right now, in the law, an SRF or the state SRF is required to deposit the 20% state match of the capitalization grant before drawing down federal funds. So some states have already made that contribution, that state contribution, but there are several states that haven't. And so they will be unable to draw down federal funds until either that contribution is made or that requirement is waived. Increased access to WIFIA. SRFs deal in the negotiated market for bonding issues. And so that is still very uncertain and unpredictable. And so, you know, if that remains so in the coming months, you know, it would be helpful to have additional access to WIFIA funding. Again, we'd love to see 100% of stimulus funding be used for additional subsidization for any applicant on any project. We think this is really important to provide governors with the flexibility to use that stimulus funding. In the previous stimulus package in response to the economic crisis in 2008 and 2009, there were a lot of restrictions placed on the stimulus funding, requirements that additional subsidization be provided, certain projects were funded. We think because of the situation this year where the impact has been so varied across the country, that, you know, communities and states are going to need 100% flexibility in order to be able to address whatever issues they might have. And so that flexibility is really important. Accelerate the projects, so waiving federal requirements for planning and procurement. Those are the two things that we think can really speed the process through. On the cost effectiveness analysis and the fiscal sustainability plan, those are things that apply to all treatment works, but some things like replacing a pipe, you know, 10 blocks of pipe or doing minor repair components, you know, these kind of requirements, while very, very good policy, may not be necessary for those types of projects. And again, those are for all projects, including those that are funded by state dollars. On the waiving the federal procurement process, this is not an issue in some states. So in Florida, North Carolina, California, this is not an issue because their procurement process is very similar to the federal process. But in states like Minnesota or Arizona or Massachusetts, it is a significant problem. And in fact, in Massachusetts, it became such a significant problem that they had to make the decision to not fund architectural and engineering services through the federal CAP grant. This only applies to funding through the federal dollars, the federal CAP grant. But that is something that, you know, while it may not be a problem in every state, where it is a problem, it's a big problem. So can you click to the next slide, please? So then it's, again, filling the SRF project pipeline with stimulus funding and total flexibility on the types of projects. And then expediting construction, this is on our website, which is more protection, less process. It's an initiative that we have, and it's just really maintaining the requirement to pay the federal prevailing wage, but streamlining the compliance process for it. And we think cumulatively that all of these things could really help stimulate the economy. And one thing I just wanted to go back to, Bevan had asked us a question shortly before this webinar about whether there was funding available in CARES. And I just wanted to direct everybody to the Department of Treasury April 9th press release about the Federal Reserve opening up the municipal liquidity facility. This is basically a borrowing tool, and it's eligible to states, to counties that have a population of over 2 million, and to cities that have a population of over 1 million. And it is eligible for, loans are eligible for revenue loss due to a reduction in tax revenue or other revenue losses. So it's not a direct solution for utilities. A utility can't go directly to the reserve to borrow funding, but they can go through the states, and so as well as other smaller municipalities, as well as I think schools are probably eligible. So I would take a look at that. It's section 4027 of the CARES Act, I believe. And I believe that it's up to 500 billion in notes, but you have to really look at what's eligible. And there's a term sheet on that web page that you can look at, which is, it's just 2 pages. It's pretty simple to understand. They do have a little bit of jargon in there, but that might be helpful.
Oh,
So
thanks,
Devin,
Deirdre.
thank
Something,
you.
if you send that to me, I will send it out to everybody
Yeah.
we invited to this webinar, so that we'll flag that for them to make it a little easier for them. Thanks, that's a great idea. And go ahead, continue.
Oh no, that's all. I'm finished. Thank you so much.
Okay, great. Well,
Yeah.
Timothy, I think we have a few more questions in the box if you want to pose them to all of our speakers.
Sure, yeah. We have one specifically for NACWA that I'll start with, and then we have one for everybody. So question for Adam from Secretary Grumbles from Maryland. Would wastewater utilities be willing to conduct some pilot tests for COVID detection in community sewer systems or at headworks of wastewater treatment systems to broaden testing scope and tracing during the pandemic, and potentially looking at like future pandemic prevention? There's different technologies and laboratories available that might be able to engage in this way.
Great, thank you. Yeah, and that's a terrific question, and it's already happening in many instances. So I'm glad that question was asked. We have numerous utilities, and I'm not going to name which companies are out there, but working with a number of private entities as well as academic institutions doing tracing for COVID-19 in their influent. Basically, the idea there is if you can find the sort of trace elements, if you will, of COVID-19 through RNA testing, you can then be able to determine the degree to which, or the severity to which it might be impacting your population. You might be able to actually get ahead of the next hotspot. And I can tell you that that's happening out in Oregon. It's happening with our members in Colorado and Massachusetts, some in this area as well here in the DC area. So there's already a lot of work being done on that front. I would just add, we are actually encouraging our members to engage in this from a scientific standpoint. At the same time, they have to make sure that whether it's the companies that are conducting the actual tests or it's their own workers who are collecting the samples, et cetera, that all of that is done safely, and that the degree to which the traces of COVID-19 are found in wastewater does not mean that the workers, et cetera, are at any risk of contracting it, and how to message the science of this effort in relation to the risk. So there are some elements here that have to be carefully taken into account. But to answer the question that's already being done, I would very much recommend that folks interested in following this or getting more involved or having their utilities in their state get more involved in this, reach out to the Water Research Foundation, and Peter Gravatt, formerly with EPA, is now the Water Research Foundation's CEO, and they are conducting sort of a large kind of summit, actually, I believe this week, on this exact issue, and looking at how it is being done both nationally here and internationally as well. But it's intriguing, and it follows on similar efforts that were done with actually with cocaine, as well as with various other drugs, to be able to trace back high drug use areas, opioids as well. So they're doing it now in the context of COVID-19, and it's a very exciting field that we're seeing emerge, and a lot of science that still needs to be done in this area. Thank you, great question.
Thank you. And we have one more. This is for everybody, so feel free to weigh in. Are there efforts underway to build small system resiliency by encouraging and including targeting funding for interconnections regionally, larger systems working with smaller systems, and maybe funding connections for wholesale water service?
So this is Deirdre. I can address that. I know several states have efforts and initiatives to encourage and support regionalization or consolidation. Washington State, Ohio are two that come to mind that have been really at the forefront of this. North Carolina as well, done a significant amount of research and identified 6 potential solutions for trying to address non-compliance issues, really on the drinking water side, but also on the clean water side. And then creating the incentives to encourage that type of partnership. I think, you know, it is a politically sensitive issue, and so you really have to build the consensus among the communities that this is a change that should be made and it could benefit them. And some of the things that the states are using are additional subsidization as an incentive, but also even in their scoring of projects that get into the project pipeline. You know, those are the types of things that are being done. Louisiana has a huge initiative that's sort of being developed right now to create a funding pool to be able to pay for those types of infrastructure projects outside of the SRF, or I should say complementary of the SRF, so that the whole state would really bear the financial burden and not just have the financial burden be on those small communities that do need to have this sort of connection to larger systems as a potential option for addressing some of their non-compliance issues.
And this is Nathan, I just want to chip in as well. You know, there are certainly a number of states that are already starting to do that, just as Deirdre just referenced. California is another one. And the question I think always becomes, is it a mandate or is it an incentive? And I think we always look for incentives and ways to drive opportunity around regionalization. And for us, it's never just strictly about connecting pipes. It is about how do we create collaboration that can be across an entire spectrum. How do we incentivize even small steps? Because what we know is those conversations are hyperlocal and really oftentimes very difficult. And so if you start small and you build in a third party kind of mediator or technical assistance provider that can come in and have those conversations with communities, help educate them on what those opportunities might look like, what incentives might be offered by a state that could be really advantageous to them, whether or not it's something like a forgivable loan for those that have gone into a regional collaboration project or other ways to incentivize it. But ensuring that you have someone that can come in and help facilitate those conversations, because they're really hard conversations to have. They take a long time to happen. And once you start to see the impacts of it and the opportunity of those, it becomes much easier. But that initial conversation, if you're having two communities talk to one another, oftentimes that's really difficult. So having a technical assistance provider or some other facilitator that can come in and help communities understand that is important. And we've got a research report we just put out from a community perspective that we'd be happy to share. And then towards the end of this year, we'll have a similar one focused on policy, both at the state and federal level, that can help incentivize some of that work.
Well, thanks so much. And we are approaching the end of our time, but I wanted to get a last question in for all of you. So, you know, so the things we were just talking about, regionalization and consolidation, and some creative uses of SRFs. So that's sort of maybe longer term help for the water industry or in the water sector. And really for operations funding right now, it looks like federal stimulus money is really important. And, you know, we do expect the municipalities and counties to turn to the states for emergency funding. So, you know, if they need it, and we will share that link to the Department of Treasury notice about the municipal liquidity and the borrowing they can do, and I'm assuming that is for operations, right? For operations, that could be used for operations for utilities.
It's for expenses, but it does specifically say under eligible uses for the cash flow purposes and for the impacts of lost tax revenue or other revenue. And I would say utility rate paying is other revenue. That's where I would capture that. Yeah.
All right. We'll make sure that we get that out to everybody else.
I mean, I don't want to. I mean, there are better experts.
We're not going to make any promises.
Please consult your financial advisor.
Yeah. So all of your groups did sign on to that letter that the water industry sent to Congress on federal stimulus money. So I just wanted to give you a last couple you know, words about that and how that's going. I think you had sent it in for maybe the third supplement. We're on the fourth now. So let us just give us some idea how that's going and what you're trying to get in there to get stimulus money.
Is that for everyone?
Open to everybody, yeah. Yes.
This is Tracy. I can tell you, and as I'm sure this is true for Adam's group, our legislative staff are in constant conversations with Hill staff and with other associations. All the associations have been, I think, exemplary in their collaborative efforts on this. And it's a very fluid process right now. You know, we've got a WRDA bill, which has some very good stuff, but it's not a substitute for something to deal with the immediate crisis. So WRDA will pursue its own track, but we still need to get more relief out of Congress, and we'll see. Obviously, it was disappointing when the Speaker of the House in about a 24-hour period backed off an infrastructure program, and we're seeing some pushback from the Senate on funding. So we're going to have to just keep up the pressure and make sure water and wastewater and stormwater are at the table, because it's not on everybody. It's not everybody's top of the mind issue.
Yeah, and if I can just add on to Tracy a little bit, the one positive to all of this is, like you said, the collaborative, work that all of the different associations are doing, as well as the municipal associations, including the League of Cities and the mayors. Water, though, is a uniquely bipartisan or nonpartisan issue, if you will. Tracy mentioned WRDA, where we can have Senator Barrasso and the entire leadership of the Environment and Public Works Committee agreeing on large funding boosts for drinking water and wastewater issues. It's been traditionally that way in the House and the Senate. My hope is that as this proceeds, and as unfortunately the unemployment picture continues to look bleak, they're going to turn to infrastructure and public works as the way to get jobs created again. And I feel fairly optimistic about the role that water can play in that context. I think we're going to see significant funding.
And I would just say that it's incredibly important to have a collective voice on this. And obviously all of us in the water and wastewater industry side are pushing hard from the Hill, but it's really important, obviously, for governors to be talking about this issue as well. And so the more of a drumbeat we can get from the state level, from the national level on the importance of this, the better those conversations will be on the Hill.
And this is Deirdre. I would just echo what everybody has said. I would say that there are two issues here. One is relief for the revenue loss, and the other is stimulus, and they should be considered as complementary. They're not mutually exclusive. It shouldn't be one over the other, because they both serve two very good purposes. And we really want to see some relief for the utilities, because many of the utilities have loans, and if they can't pay their loans, then that impacts the SRF, and that impacts projects across the state and really across the country. So we think these are two separate but very complementary things, and they can work together. And we also think that the time frame for some of the stimulus, just to add, is really the timeline for the vaccine development. So the idea of getting money on the, into construction projects for shovel ready doesn't make sense to us given this current pandemic. That there could be rolling shutdowns, and stay-at-home orders that prohibit construction. So we really want to focus on funding the entire spectrum. So the entire SRF project pipeline, from planning, design to construction, and we think that's going to create jobs across the economy. So,
right, and a lot of that planning stuff can be done from your home office.
Exactly.
I'm sure, right?
And
right?
it gets more. It gets more in the pipeline, and the bigger the pipeline, the more funding we can demand. We can advocate for Congress. So.
Okay. All right. Well, I want to thank you all so much. And I don't know, my screen has gone black. I apologize for all the technical difficulties, but that's what we're all living with, and that's a small thing that compared to our other colleagues out there. So I want to thank you all, and this is the end of the webinar, and we will be following up. I wanted to mention also that Timothy and I had written a water COVID memo, and that's going to be coming out pretty soon to all our policy advisors. And we're going to send this recording to everybody who signed up for the webinar and the AWWA report, and the link to that Department of Treasury announcement that Deirdre had mentioned. So thank you all, and stay safe out there, and thanks for all your good work in water.
Thank you, Bev.
Thank you.
Thank you.